All righty. It is November the 1st. Man, crazy. November the 1st. Why is it crazy? Well, today is the first day of open enrollment for ACA. Secondly, we now have a bunch of people calling for Medicare as usual. Phones have been going off the hooks this morning. And it's payroll day. Man, crazy. 3 hammers landing on top of me. Hey, it is what it is. All right, let's get some viewers. Let's see who joins us today. It may just be me. Man, crazy. It may just be me today. Anyway, all right. So let's kind of talk a few things right now. Let's go straight to Medicare. I want to share this new feature, and I'm going to guess maybe not new to everybody, but it's new to me. All right, give me 1 minute here. I have got a screenshot of this, and here we go. Only because it shows my social, and I don't want you guys to see my social. Okay, hold on here. Getting this screen ready to go. All right. Let's get in here and check this out. Hold on here. Open up another window. Okay, did you guys know? Let's see here. Let's make sure we're rocking. Yep, it is rocking. Okay, perfect. Just making sure I get everything ready here. Okay, so Sunfire. Sunfire is a quote and an enrollment platform for Medicare. Check this out. Hey, Patricia, working on quotes. Yeah, us too. It's crazy. All right, check this out. This is on Sunfire. So let's go look at the picture first so you can see where this is at. Come on, show me the picture. Let's see here, window. Okay, I want to show my picture and I can't show my picture. Hold on, guys, I'm getting there. Let's see here, present, screen. Why can I not show this picture? Okay, we're just going to go here to this entire window. Let's go to this window, share. Oh, that's not what I wanted. Hold on here, guys. Trying to figure this thing out. Stop sharing. Oh, goodness. Let me put it over here. How do I share this picture? It's crazy. So I took a picture. Anyway, it's called Blaze Sync URL, and it's in your settings tab down at the very bottom. All right. I'm going to try one more time. If not, I'm going to give up on this darn thing. I don't know how to share a picture of a screen. It's not letting me do this. Hold on. Hang in there, guys. I know. All right. Let's go here. I don't want this. I want that. Let's see here. Nope. Got so many windows open. Nope. Window. How about the entire screen? I think I did entire screen. Let's see here. Let's look at entire screen. Nope. Look at that. Craziness. You all don't want to see all that. Okay. So let me get out of here. Okay. Bottom line, guys, when you open up Sunfire, if you go to the very bottom on Sunfire, you click on that gear sprocket. Okay. Click on that gear sprocket and you're going to see your enrollment PURL, and then you're going to see the Blaze Sync URL and check out what it does. Now I can show you what it does. All right. So, all right, check this out. Okay, so this is my specific link. You can send this to your clients. When your clients get this, this is what they get. So they get this 2024 Medicare guide. I don't know why it says 24. It should say 2025, but regardless, they get this. Start Medicare guide. All right, so they're going to enter their name. Let's go with Mary Jones, and her date of birth is that one, Mary at nomail.com, and this is Mary's phone number. Okay, Mary goes to the next step. She puts her address. Okay, types in her county. Perfect. Continue. Now we can search for doctors. Okay, so she chooses a doctor on here. Okay, all right, she enters a doctor, save and continue. Then she enters her medications. She's got to put the first 4 letters of the med. She selects the med, she selects the dosage, the refill frequency, and the quantity. Saves it, hit save. Uses a pharmacy, of course. Which one? Let's go to Walgreens. Selects it, saves it. Now, this is also the neat thing. Okay, she fills out a scope of appointment. Start the scope. Let's just say we're going to talk about all 5 of these things. She's signing for herself, Mary Jones, and then look at the date of the appointment. We are November the 1st right now. The appointment's got to be 48 hours later. She signs it and she completes it. Boom. Now, she can click on this link. What's cool is this is your specific URL, and if she self-enrolls, you get credit for it. Okay, so she can click there if she wants to. Otherwise, you're going to go to your Sunfire. Okay, and you're going to go to your homepage, and Mary Jones right there. She just popped up at the very top. Okay, so she's on here right now. I can go down here and I can view her scope. I can go view her quote. And what's going to be cool about this is now, oh, I don't think I was sharing the wrong tab. I'm sorry, guys. So let me go back. I go back to my homepage. Okay, Mary was right there. I go down here. I can get her scope here. Okay, I'm going to go to view quote. Now, I can go pull her quote, but this is what's cool about this. Her doctors are already on here. Her medications are on here, and the pharmacy that she selected. And now I can go do all of my research. Man, that is a really neat feature with Sunfire. So here's the deal. Close this Windows. If you do not have Sunfire, okay, if you don't have Sunfire on as an option with your upline, first thing you're going to do is you're going to want to check with your upline. Hey, I need Sunfire. I need Connecture. I need whatever tool that they have. They're all pretty much the same. So get out there, talk to your upline, request it, set it all up, and you're good to go. The other neat feature about Sunfire is you can collect your SOAs on there. You can do a verbal SOA. You can do a emailed SOA, a text SOA. If they're in front of you, they can sign your device electronically. Or if you got a paper SOA signed, you can upload it there. So very neat feature. Okay. All right. That's what I got for you on the Medicare side of the thing. I also got some bad news. Okay. It came out yesterday. All right. So Aetna has come up with a lot of products that are now going to be non-commissionable. Let me pull that email from Aetna. Not a good thing, guys. All right. Look at the email. Let me share this screen. Share my window. All right. Right here. Okay. Check it out. All right. So look at this. So Aetna sent an email. In fact, it came out this morning at 6:40, or yesterday in the evening, keeping you informed. Some plans become non-commissionable. Thank you, Aetna. All right. So as a result, whatever it is, they are changing they're changing it from commission to non-commission, certain plans in these states. Okay, starting November the 1st. So what happens if you enroll people on October the 15th? I don't know. Okay, the plans below will become non-commissionable for applications. Oh, with signature dates November the 1st. So if you wrote them prior to this date, you're going to get paid. Now going forward, no commissions. There is no impact to renewing compensation for renewing members. Okay, so at least you're still going to get paid if they're going to renew on there. If any of your current members enroll into a non-commissionable plan on or after November the 1st, you will remain the agent of record and will continue to receive renewals. Okay, well, that's a nice thing. So here are the list of plans by state and then the plan name. I'm in Texas, and thank goodness there's only one, and it's not even in my county. Whoo, man. So El Paso, they're getting hit with their PPO and HMO, non-commissionable. But if you're in these other states, damn. And look at some of these plans. It gives you the plan, and then it's giving you the counties or the service areas for that plan. So not a good thing. Also, I didn't get this one, but Elevance in Connecticut and Virginia, I believe, also are non-commissionable plans. Okay. I wish I knew specifically which ones. I haven't gotten an email from yet. I did get a call from our upline and said, hey, start preparing. It's coming. But they're also going non-commissionable in those states. All right. So that's that, guys. That is Medicare hot news. Hey, Patricia, how are you doing on quotes? We're November the 1st. You working on ACA Medicare quotes? Let me know. Okay, Steven, got 2 deals so far. Everybody in, yep, hopefully. It's been a little slow, guys. Now, I've been doing this for a long time, and I will tell you this. Election cycle years, okay? It gets slow until the election. I've experienced it a couple of times, so this is normal in my opinion. So it's a little slow right now. Wait till the election is over with. Once the election is over with, it'll pick up, and then it'll slow down right during the Thanksgiving week. And then get ready. After Thanksgiving, it gets stupid crazy. Okay. So that's just kind of the normal rhythm of how it works. Okay. So don't worry. Patricia, yeah, you're doing ACA. Awesome. Yeah, we're going to bang out ACA like you wouldn't believe today. So also know this, guys. We're trying to figure out the workaround on the ACA side of the house. Okay. Their Oscar. You can quote Oscar on Health Sherpa, but if you select Oscar, you're going to have to go to healthcare.gov, which is not a good thing, or you're going to have to go to the High Oscar business login site and do your application on there. I'm going to have to work on my first one today, so I'll probably post a video on how to do it on High Oscar, but not a good thing. Okay. Also, I did post a video about not being that agent that gets canned from a carrier. So you want to make sure, guys, that you have your method of consent and confirmation. Okay. Make sure that you have that method down. Otherwise, you're going to have some issues. Okay. So let's get in. I'm going to share this screen. This is the way I'm doing it. All right, we can get this ready here for y'all. Hold on. All right. So I am using Agent CRM. Ivan, will you please share that link for Agent CRM? So what you're going to want to do, guys, this is Will. He's one of the Agent CRM tech guys. You have to collect your consent and confirmation in this manner, and you have to do it without fail. Okay. They're cracking down. I got the complaint from the agent, and this agent did not get consent and confirmation. He's totally screwed. The client's complaining, saying that they never gave the authorization to enroll. So he's totally out of luck. All right, let's get in here and take a look at this. So there is a timeline of this stuff. So you're talking to your client, you're gathering the data, you're doing the research, and they select the plan, and you're rocking right before you do the search. So you hit add to cart, click a button, and a search box pops up where you enter their name and their date of birth and their state, and you hit search. And what it's going to do there is going to look for the client to see if they already have an app. Okay. When you have to collect consent before you do that, because in that complaint, they want timestamps. And so there's a timestamp of when you did that search, and there's a timestamp for your data for your consent. Make sure that you got the consent. So this is the way I'm doing it. There's 2 ways. Number 1, you can go to your CRM, whichever CRM you got, and you can enter. The way I'm doing it is you go here and you click on sending a text or an email. My first choice now is to send an email. When you send an email, this is what happens. Your client will get an email like this. Now, I uploaded my logo, and it says, hey, Will, please view this document. Okay. Document pops up. Okay. This is what it's the actual consent. So it'll have the date on here. It'll have the consumer information. It'll have the NPN, your NPN. And there will be a box here where he can sign. Okay. He's going to have his, literally he can choose what's given to him or draw the signature. Okay. Then it pre-fills everything in here. And then then he's done. He'll hit a button that says finish and he's over with. Then this is what happens. You get a notification that it is signed. Okay. You can go here to download it, or you can go over here to documents, whichever way you want to do it. Let's go here to download it and view it. Now, consent, there is his consent, his signature, but this is what's beautiful. This is what you need. You need a signature certificate. Okay, this is the data that proves it was them. You have an IP address now, you have a location, and you have a timestamp. Now, once you collect this, let's go back to the CRM. Okay, once you collect this, then you can go do the search. But let's pretend that your guy is a computer. He can't figure this thing is so easy. If they can't figure it out, damn, I don't know how these people sometimes survive. But check this out. You can click to send a text in English or Spanish. It sends them the consent form, and then just have them reply back with I consent. If you don't get consent, guys, I will warn you. I will tell you, don't freaking write them. Be done with them. Move on to your next client. Because when they complain and screw you over, you're not going to have a leg to stand on. Okay. And one client is not worth getting suspended or terminated. Okay. So, and getting a text message was one of the methods that they asked that we could get. Okay. But I just think there's a signature is golden. Okay. So let's continue. Now, I go through the entire application and I get to almost the very end. When I get to the very end of it, almost I think two next that you have to hit to finish and sign. There is a screen that says finalize, and you're going to see a blue print button on the top right. Okay. Print that as a PDF. That printout that you're going to be printing has the contact information, name, phone number, email. It has all the members in the household, their names, their date of birth, their last four of their social. It'll have their gender, and it'll also have whether they are going to enroll or not. So you may have mom, dad, and two kids, but you only can insure mom and dad. It'll say yes for mom, yes for dad, but the two kids will say no. Okay. Then it'll have all the income information. Then it will have answers, the questions with the answers. It's all the data on the app. What you do next is you grab that, you save it into a folder, and you call it John Smith Final App Review. Then you go here and you upload it. Literally, you just click on the button, you go find it. Okay, you find your file, or you just drag it here. Then you get a button here that says confirm. You confirm it. Then you choose how you want to send this to the client. You can text it to them in English and Spanish, or you can email it. This is what happens. I texted it to Will. Will got this message that said, we're reaching the final stage of your application. Take a moment to verify that everything is accurate. He clicks on this link. The link opens up the finalized. This is what it looks like. All the information is here. Now, once he views it, I am going to wait for the I confirm. Okay. Now I can submit. Once I get the I confirm, I can proceed to the next two stages, type their name at the bottom, and submit the application and get the eligibility. Now, I am going step 3 in this thing. Step 3 is this, guys. Part of that complaint was, why did you enroll them in the plan? Okay. Well, I want to make sure I'm calling step 3 my CYA. You know what that means? Okay. So what I'm going to do now is, while I'm in the quote, I'm going to pull up their summary of benefits and I'm going to have it ready. I'm going to take their summary of benefits and I'm going to load it right here. Okay, grab it, drop it, or hit upload and go find that specific summary of benefits for that client. And I'm going to send a text or an email to that person. And it's going to say, and I sent it to him in Spanish because I already done it in English, but this is the wording in Spanish. It has the link here for their document. And then I created a video. It's a generic video that explains how to read a summary of benefits. That's it. So they get 3 things from me: consent, confirmation, and then the CYA step. All right. Pretty cool. Make sure you're doing that for everybody, guys. You're going to get screwed if you don't. Okay, let's take some questions. Luis Garza, Ambetter and Sherpa. Let's see here. A question about Ambetter. Let's see here. Let's post this question. Okay, Ambetter and Sherpa. In Sherpa, some states have 2 Ambetter options. Yes. Which one to pick? Okay, number 1 is Luis. You should have been on their trainings. They posted emails all through September and October for trainings. That explained their plans. Okay, so you got to go in there. Maybe you got recordings. So, guys, I always urge you, when you get emails from the carriers and their trainings, you have to be on those emails, because then you're in a scenario like this where you don't know. Now you're going to have to go and research it. Here is my guess. In Texas, we have a value plan and their regular plan. And the difference between those two is network. The value, well, first of all, we're going to make a lot less commission with value. They just posted that out. Okay. And as far as premium, the value is going to be cheaper than the regular plan. So also we make less commissions on that value. And finally, the real difference, and I know Texas because that's my area, the difference is the network. The value has a limited network. It doesn't have as many doctors, doesn't have as many specialists, it doesn't have as many hospitals. I think the formulary is the same, but I'm always checking the formulary anyway. So it doesn't matter if it's the same or not. I'm verifying that those meds are in the network or in the formulary list. But I do know that on the value, the list of doctors goes from here to here. So here's my guess on this one, is that doctors that agree to be on that value network are getting paid less for those procedures. That's why there's not that many doctors on there. And that's just my guess, Luis. So you're going to have to go in there and you're quoting 2 and you're going to see one that's cheaper. That's probably the one that has the limited network. So in Texas, that's what it is. I don't know about the other states. I'm 99.9% sure that it's going to be network. The value is a network. So how do you pick one? You do your job. You get your doctors and your meds. And what you do is you click on, you do the search, and on the value plan, find if there are doctors in there or their meds. If it is, rock and roll. Make sure your client knows that this is a limited network and this is the facilities. This is your urgent care. These are your hospitals you're going to go to. You're going to do the very same job on the big one, on their regular one, and then let them tell you which one they want. That's what I would suggest. Good question. Guys, ask your questions. I'm a little overwhelmed this morning. I get calls and calls and calls. And in addition to that, I got payroll to knock out today. So ask your questions. Otherwise, we're going to cut this one a little bit short. But will I get paid if I pick the wrong Ambetter plan? Yep. The value is probably $5, $6, $7 cheaper, or not cheaper, less commissions than the regular plan. So you'll get paid if you screw up. But here's the deal. A screw up is not a good thing. If you choose the wrong plan, you just screwed your client up. So if you do your job, then how can you pick the wrong plan? Okay. If you do your job and you collect your data, okay, you ask the insured for all their information, and you collect the doctors and the meds, and you do the research and you present that to your client, how can you pick the wrong plan? Maybe your client picked the wrong plan, but you're presenting, here's the Ambetter value, here's the Ambetter regular. Which one do you want, Mr. Client? Okay, and let them tell you. So I would say, yeah, you get paid whichever one you pick, but you get paid a lot less with the value. Yeah, we'll select both of them and then enter your doctors and your meds and do your research. Let's see if I can, let's do this here right now. Okay. Give me 1 minute. I am looking, well, kind of odd here. Let's see here. Focusing just on Ambetter. Give me 1 minute. I am knocking this out. Okay, so let's go. I'll share this screen now. Okay, so you're seeing, I ran a quote here in my area. I selected Ambetter. Last year, we had two different Ambetters. Now it's just one Ambetter. Okay, but I'm quoting from lowest premium, and it gets more expensive as I work my way down. So this is the everyday gold one, $28. So let's go to the doctors. Okay. Okay, I'm just doing 25 there. Okay, let's go. Okay, so here's, I had the value. This is this selective network of providers and hospitals supports Ambetter's lowest premium. Then you have the Premier, which is the broadest network. And then you have the TX SMP. This is offering providers for the TX. Okay, that's new. But let's do value. Start browsing. So San Antonio, let's look at hospitals in San Antonio. So in San Antonio, here is the list of hospitals. I have the Methodist Health System. Okay. I have the Baptist Health System. That's pretty darn good. Okay. Let's see what else I've got. I need Christa Santa Rosa and University. And I don't think I'm going to get that. I'm already going outside. So I've got Baptist and I've got Methodist. So I'm going to go here. I'm going to hit edit and I'm going to change this to the Premier. Okay, so let's do this. How many hospitals do I have? I have 33 hospitals here in this area. As soon as I change this to Premier, let's see if it increases. I went from 33 to 58. That's the difference. Now look at all the different hospitals in the area. Big difference. Okay, it's 58, almost double the amount of hospitals. Let's get out of the hospital area and let's go find primary care doctors. Okay, so PCPs under the Premier, It pulled up 75 just based on this little search here. And if I change this to value, I went from 75, get the same 75, so not bad. Okay, so maybe it's just a hospital system. I don't know. Let's go in here. This is a friend of mine. No, he's not with Ambetter. I know he's not with Ambetter. Let's go check. No. Okay, let's go Cardi. So let's see here. So just searching under cardiologist. 43 show up under the value. Let's see if under the premier it changes it. 43 to 52. All right, so there we go. At least on the specialist it's changing. So again, it's a bigger network. Now I'm going to go back to the quote, and let's just focus on silver plans with Ambetter. So you're going to see here the regular plan here, regular. For some reason, this is what I found odd, is that the value plan was actually more expensive. So I'm probably not going to sell the value plan. Okay, the coverage is the same, but it's priced more expensive, so I wouldn't be doing it. Okay, so you've got to do this kind of research. If you want to do a side-by-side, let's compare. Let's take this standard one and let's put it against this value one. Do a side-by-side. And let's see, here's your standard, here's your value. Standard has a higher out-of-pocket than the value. They're both silvers. So silver, the value is actually richer. Okay, the copays are higher. You just got to study it. Study the plans for your clients in your area. Okay, let me go back and see. There's another question. Okay, perfect. All right, guys. I don't know if you got questions or not. Post them here if you like, but it's November the 1st, a little crazy. We've got ACA OEP today, the first day. I got payroll to handle. And number 3 is it's still Medicare AEP. So busy. With that, guys, I'm going to rock and roll. Thank you for being on today's call. Make sure you're doing everything right, guys. This is a long-term deal, okay? Also, if you want agent CRM, guys, if you saw my demo there for agent CRM, if you want agent CRM, here we go. There is the link to go get it. If you use my link, you will get those workflows for the consent, the confirmation. You'll get all that. All right, I did see a comment come through. Let's see here from Teddy. No, TP, I have no idea. Why would we ever write a non-commissionable? Exactly, never. The problem is we didn't know they were non-commissionable till yesterday evening. So yeah, why would you? I mean, let's just say it's your mom and you've got 5 carriers, but your mom's doctors and medications are only in that non-commissionable plan. Are you going to put your mom in that other plan where you make a commission, but none of her doctors are in there or none of her meds are in there? Probably. Me? No, I'm not going to do that. So, but then again, I don't have a trust fund. I got to eat. So it's a battle. It's really a battle. So yeah, why would you do it? I mean, I have some carriers on the ACA side that are non-commissionable. I don't offer them. Hell no, I got to eat. If they want them, hey, go get it yourself. I'm not going to help you do it. So I've got a business to run. I got a family to feed, and I got retirement in about 8 years. So I don't have that luxury to help people and not get paid. So I agree with you. It is awful, but they're not the only ones that did this, guys. WellCare did this with their PDPs. Okay, they're non-commissionable, and also their renewals. They're not paying renewals. So WellCare totally screwed their agents that have PDPs. Aetna said no commissions on PDPs, the new ones, but they're at least paying renewals. And now the news that we got late yesterday that they're making all these plans non-commissionable. Also, Elevance. Okay. I don't sell it, so I'm not worried about it. But if you're selling Elevance out there, I think in Connecticut and one other state, I mean, I got so many calls yesterday, and those, and I'll post later, but in those states, they're also going non-commissionable. So, what are they calling the non-commissionable community service plans? I don't know. I can go back to that email. I don't know if there is a specific name for that. But they pretty much, I'm reading here and it's saying this amendment to your producer agreement goes into effect November 1, 2024. You are responsible for understanding the obligations contained in it. You are bound and subject to the terms of the amendment as of November the 1st. So they're pretty much saying, hey, this is the way it is. Take it. Okay. So it sucks, man. I'm kind of lucky that in El Paso, I don't even have a client in El Paso. That's 8 hours away from me. Thank goodness that doesn't affect me in my county, Bexar County. And not really for Medicare, I only sell in my county. But this is going to affect a lot of agents in California. What is it? Connecticut, DC, Florida. Man, I'm not even sharing. I'm sorry. Let me share the screen. Let's go back in here. Right here. All right. Look at that. So California, Connecticut, DC, Florida. Look at all the plans for Florida. Ugh. Okay, Maryland, also not good. New York, not good. Man, New York really taking a hit. Okay, Texas, two plans in one county. So it sucks for those agents in that county, but all you got to do is go write something else. Virginia, one plan, but a ton of counties. Washington, man, it just kind of is what it is, guys. Can't control that. Who knows why? Okay, all right. So I don't know what they're calling them. I wish I knew. But my book of Aetna is tiny. I don't have a lot of Aetna. I have my book is primarily United Healthcare. And thank goodness that they are not making changes. In fact, all this craziness of AEP with the change in the prescription engine going from no donut hole and the out of pocket going from 8 to 2, and then the reduction in some benefits with United is just, people are calling me, do I need to switch? I love United. I'm like, no. So most of my calls are 1 to 2 minutes. Stay put. My United book is solid. So make sure, guys, that you're writing with good, solid carriers. Humana is a good one. Look at what Aetna's doing. I don't like that crap. And then somebody like Devoted. Whew, good thing I only had one, and I moved her out. But geez, Devoted went from 4,000 dental, which was their strong point, to 0 dental in 2025. So those of you with big Devoted books, at least that's what happened in my county. I don't know about the other counties. Okay, guys, I'm going to roll out. Thank you for being on today's live. I appreciate it. Watch it, guys. Just remember, we talked about the consent confirmation, that tool with Sunfire, awesome tool for you to collect data for your Medicare clients. Ask your upline for it. There is a cost to Sunfire. It's not free, but I don't know of an upline that doesn't pay for it. So they just don't hand it out there. You got to go get it. All right, guys. Thanks again. If you're catching this later and you're not one of my subscribers, please subscribe to the channel. And finally, guys, I'm going to share one more thing. Guys, we have created a community. In fact, let's see if I got the information on the community here. All right. We do not have it here, but here is, let me share the info. So this community, guys, we're doing a lot of stuff. If you want to come join us, I'm I'm going to post the link on here. First, I guess let me share the, come on. All right, let me share. Okay, I'm going to comments. I'm going to post it in the comments. It's not what I wanted. Hold on, guys. Control C. Okay, here we go. Come on, work for me. All right, there it is. Post it in the comments. Guys, we have a community on here. So here we go. So it's $50 a month, guys. You know, we're doing a lot for the agents, and they're more than what I'm doing for out there for everybody else. But we are really trying to bring you guys together. Number one, share everything that we're doing. We're going to help you with your quotes. We have a submission form. You get in there, you plug in your data, send it to us. We'll quote it for you, and depending on the data you give us, we'll tell you why we selected that plan. So that's going to be super value. Plus, look at all these 2 pages of goodies. Okay. We're going to I have a weekly mastermind. Weekly, guys. We sit there and we talk Medicare ACA. After the AEP and OEP ends, we'll go to monthly. Okay. We're going to give you ad templates and help you with your lead gen. Okay. All the ads that we're running. Okay, we're going to, I use AI like you wouldn't believe. Okay, so I'm going to share AI stuff with you. Okay, how we use AI in our business. Okay, I use AI a ton. We're going to do workshops on well, what we, you guys don't know this. Well, you guys do know this. We're insurance agents, but we're also business owners. Okay, so you got to run your business. So I'm going to bring in people that are going to help us run our business. Tax pros. Okay. We're going to bring in financial pros. If you're not saving some of the money you're making, then when are you going to retire? You're going to keep working when you're 60, 70? No, you want to hit retirement. You got to start saving. I'm also going to bring in people that will help with business planning, goal setting, setting yourself up for success so that you don't have to keep doing this forever. Okay. Compliance and recertification. Okay, we got to deal with that every year. Carrier specific training. So I'm going to bring in the reps from those areas, for those products to come give us this stuff in and out. And then all the tech tools that I have. I'm working with these companies to give us discounts. Hey, I'll bring you a group of people. They'll buy the product. Give me a discount so they're incentivized. So I'm working every tool that we utilize. I'm working on getting that for you guys. And then making money, cross-selling. We're going to share everything with you on cross-selling. We make a good amount of change on cross-selling. A measly $50, guys, we'll 10 times that every single month if you come join us. So think about that. There's a link. Come and join us. I'd love to have you. All right, what do I have here? Give me 1 minute. Ana says, Luis, ya compré el agent CRM, which means she just bought the ACM. So she is asking me if I can share the workflows. Yes, I can. Email me so I can email agent CRM staff to put it in there. You're supposed to get it automatically. So send me an email. Here's my email. Okay, Luis at 360insurancegroup.com, and put on there, Luis, I want your workflows. They're not in here. A lot of times they are, but you don't know where to go and find them. Okay, so let's make sure we're getting that to you. All right, so come join us in the community if you like, guys. It's $50 a month. Man, you will get a lot out of it. All right, I got to roll, guys. Thank you so much. Let's see if there's any final comments. Nope, no more. Again, thanks again, and we'll see you all next Friday. Bye-bye.